Have you ever noticed that despite thinking you're suffering from erectile dysfunction, ED, you still experience morning erections? It's a common misconception that the occasional difficulty in achieving or maintaining an erection signals a permanent problem, especially when morning erections continue to occur. Erectile dysfunction is not always something to be deeply concerned about, particularly when you're still able to have morning erections. ED can often be a temporary issue caused by factors such as stress, anxiety, fatigue, or even lifestyle habits. Recognizing this distinction is crucial in addressing the issue effectively and avoiding unnecessary worry. There's a lot of discussion around how to manage erectile dysfunction, with the most common approach being the use of pills or medications. While these pharmaceutical options can provide a quick fix, they often come with side effects and address the symptom rather than the root cause. Taking pills may seem like the easiest solution, but they tend to be temporary and might not solve the problem permanently. This raises the question, what if there's a way to fix erectile dysfunction permanently, or at least in the long term, without relying on medication? To explore a more permanent solution, we need to understand the mechanism of how erections work and identify the key factors that influence this process. One of the most important molecules involved in erectile function is nitric oxide, NO, and it plays a significant role in how the body regulates blood flow and responds to sexual stimuli. 1. Nitric oxide, the key molecule for erectile function. When discussing ED, the role of nitric oxide, NO, cannot be understated. Nitric oxide is a naturally occurring molecule in the body that acts as a vasodilator, meaning it helps relax and widen the blood vessels. This relaxation of smooth muscles in blood vessels is crucial for proper blood flow, which is directly tied to the process of achieving an erection. When a man becomes sexually aroused, nitric oxide is released, which triggers a chain reaction that allows blood to flow into the penile tissue, leading to an erection. Medications like Viagra and Cialis work by enhancing the effects of nitric oxide, thus increasing blood flow to the penis. But the function of nitric oxide goes beyond just improving erectile function. It is also important for cardiovascular health and plays a role in maintaining overall body function. For instance, nitric oxide helps prevent blood clots, reduces inflammation, and supports the health of blood vessels, which is vital for heart health. A healthy cardiovascular system is directly linked to sexual health, and a failure in either can affect overall well-being. Another critical role of nitric oxide is its involvement in testosterone production, a hormone vital for male sexual health. Testosterone affects libido, sexual desire, and helps in maintaining strong erections. As men age, testosterone levels naturally decline, which can lead to reduced sexual function and increased instances of erectile dysfunction. Nitric oxide helps stimulate testosterone production and also influences other hormones that regulate the amount of testosterone in the body, making it a vital factor in sexual health. Additionally, nitric oxide helps manage cortisol, the body's primary stress hormone. This is important because high levels of stress are often directly linked to erectile dysfunction. When stress is elevated, the sympathetic nervous system, responsible for the fight or flight response, becomes dominant. This system, when overactive, can inhibit erections because it causes the body to be tense and alert rather than relaxed and ready for sexual activity. Nitric oxide helps regulate cortisol levels, promoting relaxation and improving sexual function. 2. The link between stress and erectile dysfunction. One of the most common underlying causes of erectile dysfunction is stress. Our bodies have two main systems that regulate how we respond to various stimuli: the sympathetic nervous system and the parasympathetic nervous system. For a healthy erection to occur, the parasympathetic system, which governs rest and relaxation, must be active. However, when we're stressed, the sympathetic system takes over, inhibiting the parasympathetic system and making it difficult to relax, which is necessary for an erection to occur. This brings us to the phenomenon of morning erections, which many men with ED continue to experience. Morning erections happen because during sleep, stress hormone levels, such as cortisol, are at their lowest. The body is in a relaxed state, governed by the parasympathetic system, allowing erections to occur naturally. If you're experiencing ED but still have normal morning erections, it's a strong indicator that the root cause of your erectile dysfunction could be stress-related. Reducing stress in your life could lead to an automatic improvement in your ability to achieve and maintain erections during waking hours. 3. Sleep apnea and erectile dysfunction. Sleep is another crucial factor that has a significant impact on erectile health. Conditions such as sleep apnea, a disorder in which breathing repeatedly stops and starts during sleep, can drastically increase the risk of erectile dysfunction. Sleep apnea prevents the body from entering deep, restorative sleep, which in turn affects various bodily functions, including the production of nitric oxide and testosterone. Men with severe sleep apnea are at a much higher risk of developing ED. The lack of oxygen that sleep apnea causes can damage endothelial cells, which are responsible for producing nitric oxide. Without healthy endothelial cells, the body cannot produce enough nitric oxide, leading to poor blood flow and erectile dysfunction. Improving sleep quality by addressing sleep apnea and other sleep disorders can have a profound effect on sexual health. Proper rest allows the body to repair itself, reduces stress, and enhances overall nitric oxide production. Simple lifestyle changes such as maintaining a consistent sleep schedule, reducing caffeine intake, and creating a relaxing bedtime routine can significantly improve your sleep quality and, in turn, your erectile function. 4. Diabetes and erectile dysfunction. Diabetes is another major factor that can lead to erectile dysfunction. Men with diabetes are at a much higher risk of developing ED due to the damage that high blood sugar levels can cause to blood vessels and nerves. Specifically, diabetes can damage the endothelial cells in the blood vessels, which are crucial for producing nitric oxide. Without sufficient nitric oxide, blood flow to the penis is restricted, making it difficult to achieve or maintain an erection. Increasing nitric oxide levels in the body can help improve insulin sensitivity, which is essential for managing diabetes. By boosting nitric oxide through diet, exercise, and other natural methods, men with diabetes may see improvements in both their blood sugar control and their erectile function. It's also important to note that certain medications used to treat high cholesterol, such as statins and fibrates, can sometimes contribute to ED. These medications can interfere with nitric oxide production, further exacerbating erectile dysfunction. If you are taking these medications and experiencing ED, it's important to talk to your doctor about possible alternatives or additional treatments to help address the issue. 5. Natural ways to increase nitric oxide levels. Given the significant role that nitric oxide plays in erectile function and overall health, it's important to explore ways to naturally increase its levels in the body. Here are some proven methods. Nasal breathing. One simple and effective way to boost nitric oxide production is through nasal breathing. Nitric oxide is produced in the paranasal sinuses and released into the nasal airways. By breathing through the nose rather than the mouth, this nitric oxide reaches the lungs and circulates throughout the body, improving blood flow and vascular health. Regular exercise. Exercise is one of the most effective ways to increase nitric oxide production. Regular physical activity, particularly aerobic exercises like running, cycling, and swimming, stimulates the endothelial cells in the blood vessels to produce more nitric oxide. Exercise also helps reduce stress, which is essential for managing erectile dysfunction. Incorporating activities like yoga or meditation can further enhance relaxation, improve blood flow, and lead to better erectile function. Nitrate-rich foods. Certain foods are high in dietary nitrates, which the body can convert into nitric oxide. Adding these foods to your diet can naturally increase nitric oxide levels and improve erectile function. Some nitrate-rich foods include spinach. Contains 24 to 387 milligrams of nitrates per 100 grams, depending on growing conditions. Bok choy provides 103 to 309 milligrams of nitrates per 100 grams. Beets, known for their high nitrate content, beets can significantly increase nitric oxide levels in the body. Studies show that drinking beetroot juice can boost nitric oxide levels by 21% within 45 minutes. Carrots contain 92 to 195 milligrams of nitrates per 100 grams. Other foods, garlic, pomegranates, citrus fruits, dark chocolate, nuts, seeds, and watermelon are also rich in nitrates and beneficial for increasing nitric oxide levels. 6. Avoiding factors that lower nitric oxide. Just as it's important to boost nitric oxide production, it's equally important to avoid factors that can reduce its levels. Some common lifestyle habits and substances can lower nitric oxide and contribute to erectile dysfunction. These include sugar. High sugar intake can lead to the formation of atherosclerotic plaque, which damages the endothelial lining of blood vessels. When this lining is damaged, nitric oxide production decreases, making it harder for the body to maintain healthy blood flow. Alcohol. Excessive alcohol consumption can reduce nitric oxide levels and impair endothelial function, contributing to ED. While moderate drinking may not have a significant effect, heavy alcohol use can worsen erectile dysfunction over time. Stress. As mentioned earlier, chronic stress lowers nitric oxide levels and triggers the sympathetic nervous system, which inhibits the relaxation necessary for an erection. Finding ways to manage stress through relaxation techniques, regular exercise, and adequate sleep can help restore nitric oxide levels and improve erectile health. Improving sleep for better erectile health. Sleep is another critical factor for maintaining nitric oxide levels and reducing stress. A consistent, restful sleep routine can help regulate stress hormones, support endothelial function, and improve overall sexual health. Ensuring you get enough quality sleep each night can significantly improve your ability to achieve and maintain erections. Medications and erectile dysfunction. It's also important to be aware that certain medications can cause temporary erectile dysfunction. If you've recently started a new medication and noticed changes in your erections, consult your doctor. They may be able to adjust the dosage or recommend alternative treatments that won't interfere with your erectile function. Conclusion. Addressing erectile dysfunction is a complex, multifaceted process that involves managing stress, improving sleep, adopting a healthy lifestyle, and boosting nitric oxide levels naturally. Nitric oxide is a key player in maintaining healthy erections, and by understanding its role, you can take steps to naturally enhance your body's production of this essential molecule. By making simple lifestyle changes, such as exercising regularly, eating nitrate-rich foods, avoiding stress, and improving sleep quality, you can significantly improve your erectile function and overall health. Remember, if you're experiencing persistent issues with erectile dysfunction, it's always a good idea to consult with your doctor to explore the best treatment options for your specific situation.